In the last 8 months, Atlanta alone, have reported 20,000 HIV cases.
100% false. Welcome to another episode of J Inclusive. Please share, like, comment, subscribe, and set your notifications on so you are alerted every time I upload.
I don't know how many times I can say this, but I'm going to say it every day if I have to. You need to keep your legs closed. I don't know what the hell is going on.
She's right. She doesn't know what's going on.
But sex is not one of them things that you need to be doing. It's not worth dying for. And I don't care how good the medication is now. I don't care that it is now not a automatic death sentence like that as it used to be. I don't care. Keep your legs closed. 20,000 cases in the last 8 months in Atlanta. Is it worth? I wish I would even go visit down there. It is not going to happen. And unfortunately, I know some people that have contracted it. To be truthfully honest with you, all of them happen to be men. It's not worth your life. Protect yourself. Leave it alone. Go get tested together. Know your status. Take PrEP.
There is no official figure for new HIV cases in Atlanta for 2025. Matter of fact, there are no official numbers for new HIV cases nationwide either. Her false reporting led others to do the same, some saying there were 20,000 cases in a month, and some said 20,000 cases in a week.
So I don't know if y'all saw, but there's a woman who came on here and said, in the last month alone, 20,000 cases of HIV have been reported down in Atlanta. Girl, what? Are you serious?
100% false.
Medicine has come a long way in the treatment and understanding of HIV, but there's still some false reporting and a lack of knowledge when it comes to the virus. 11 Alive's Jennifer Bellamy spoke with experts to verify just how many cases we're seeing right here in Atlanta.
A viewer spotted an online post claiming Atlanta is among several major U.S. cities experiencing a massive outbreak of HIV right now. So is that true? Let's verify. Our sources are the Centers for Disease Control and Prevention, the Fulton County Board of Health, and the Georgia Department of Public Health. Here's what we found, starting with some background. The CDC defines an outbreak as an occurrence in which there are more cases of a disease than what is usually expected. An agency spokesperson shared a statement saying in part, many areas of the United States are experiencing clusters and outbreaks of rapid HIV transmission, where transmission rates are much higher than the rest of the nation. It went on to say, according to recent CDC data, more than 400 HIV clusters have been identified nationally in recent years, the majority in the South. But what about Atlanta specifically? The Georgia Department of Public Health's HIV epidemiology director called the Atlanta outbreak claim misinformation that's been circulating for several weeks now. DPH sent us this data tracking new HIV diagnoses in Fulton County, where Atlanta is located from 2018 to 2023. The numbers show a decline in the last 3 years of available data. The Fulton County Board of Health came to the same conclusion. A spokesperson told us, based on its recent data from 2023, there is no evidence of a new or active HIV outbreak in the Atlanta area. But he did caution that the region continues to experience high rates of HIV diagnoses and prevalence, particularly among the Black and Hispanic or Latino communities. So we can verify, no, Atlanta is not experiencing an outbreak of HIV.
None of these people, including this woman, have provided any sources for their claims. In 2022, there were 31,800 new cases of infections nationwide, but the number of new infections in Atlanta for that same year haven't even been released. So if the numbers for the previous year haven't been released, how are their official numbers for 2025? I visited the websites for the Georgia Department of Public Health, Fulton County Department of HIV Elimination, Centers for Disease Control and Prevention, Emory University, AIDS Atlanta, and Cause IQ, organizations that track new infections in Atlanta specifically. And none of these organizations have released any information regarding 20,000 new cases. It simply isn't true. This disease is not for clicks, views, or virality. If you're going to come to the internet and act as though you're alerting others about prevention, make sure you do it responsibly and that you are accurate. We all know what will come of this woman making these false claims about Atlanta, a city with a huge black, gay, and transgender population. I've already seen countless comments of people demonizing gay and trans people and placing blame solely on them, as if prevention isn't up to all of us. It is true that Atlanta is in the top 3 cities in the nation with the highest rate of new infections, but it is nowhere near 20,000 a year, not even close.
Metro Atlanta is the 3rd highest ranking for HIV diagnosis in the country. So this is according to data from the Centers for Disease Control and Prevention.
Local clinics say they are already seeing more positive cases. 11 Alive's Teresa Bowles is live with us in studio to explain why even healthcare officials are shocked at these numbers.
Well, Jennifer, I want to provide some context here. Though the data is most recently available, the information is from 3 years ago. So I set to find out what Atlanta's cases look like today. HIV may not look like it did 30 or 40 years ago, but Atlanta expressed its shock when observing a recent trend.
This quarter for 2024, we've already reported more positive individuals living with HIV than we did the quarter in 2023.
AIDS Atlanta mostly serves Fulton, DeKalb, and Clayton counties, so if we take it beyond Atlanta to the metro Atlanta area, recent Centers for Disease Control and Prevention statistics really puts things into perspective. A spokesperson for the CDC says, quote, "The Atlanta, Sandy Springs, Alpharetta, Georgia metro political statistical area was 3rd nationally for HIV diagnosis in 2021, right behind Miami and Memphis." Dwayne Ford is the director of HIV prevention services with AIDS Atlanta.
We're all trying to figure out, why we're getting more people that are diagnosed with HIV when we know there are more prevention tools out there.
When you expand it to the entire state, current preliminary data shows Georgia is 4th in the country for HIV diagnosis. Concerned residents started sharing this information all over social media, some saying they're now afraid to date here.
There's fear, and that's with anything that's unknown. HIV does have a stigma.
It's important to note that this same data shows infections are 12% lower in 2021 than they were in 2017. But there were still some pandemic restrictions in place that could be playing a role in that data. Still, Ford wants to remind everyone that this disease is not a death sentence.
The message continues to be the same as it always has been. Prevention methods are out there.
Ford suggests talking with your healthcare providers about preventative medications, such as PrEP, so you can protect yourself. There are also resources in the city to help with the cost of testing.
Now, while anyone can get HIV, Black Americans are disproportionately affected. The CDC reports that while Black people account for 13% of the U.S. population, they made up 40% of people with HIV in 2019. On average, 1 in 16 Black men and 1 in 30 Black women will be diagnosed with HIV at some point in their lifetime. So let's bring in founder of the Black AIDS Institute, Phil Wilson, for more on this. Phil, thanks for being here. CDC data shows that over the past decade, new infections have dropped among white, gay, and bisexual men, but remained flat among those who are Black, Hispanic, or Latino. Why are we seeing these higher rates to begin with? And then why aren't we seeing these numbers come down in these communities?
Well, thank you for having me, Diane. And, the CDC recently released a report showing that Black people are disproportionately impacted by HIV on every level. We get infected at higher rates, as you just reported. We get sicker faster, we die faster. Interesting, that's a report that has been released every year for the last 40 years. So Black people have been disproportionately impacted by HIV since the beginning of the epidemic. It's kind of like Groundhog Day every February where we release this information. There are a number of fundamental issues that continue to exist. High rates of poverty, housing instability, the issue around discrimination, and a distrust of both the healthcare system and systems in general in the United States as Black people feel mistreated and facing all sorts of challenges.
Now, throughout the pandemic, we've heard a lot about the disproportionate impact of COVID-19 on communities of color. Is there a common thread here?
Yes, I think that there certainly is a common thread. One would have hoped that we would have learned lessons from HIV and AIDS, and clearly we have, but we have not learned them well enough. For many of us in Black communities, we feel like it's deja vu. We feel like the same processes that we experienced in the HIV pandemic, we're experiencing in COVID-19. And now we're facing the dual epidemics. What we see is that Black people who are living with HIV, or people in general living with HIV, disproportionately those people are Black, also face higher incidences of COVID-19. The severity of the disease with COVID-19 is greater for people who are living with HIV as well.
And so is there sort of one key area that needs to be focused on, access to medication and healthcare, for example? What do you think is sort of one key place that communities and that leaders can focus on to try to at least get this going in the right direction?
Well, I think that we've been plagued with kind of fits and starts. And so if we want to have success in addressing the disproportionate impact that HIV and AIDS and now COVID-19 is having on Black communities, we have to have an all-out effort that is sustained and consistent over time. And that's not happened. We launch initiatives, and then those initiatives drop off, and then we launch new initiatives, and then those initiatives drop off. And so if we want to be serious about fighting both HIV and COVID-19 in Black communities, number one, we have to have an all-out effort. We have to be consistent about that effort. We have to engage the entirety of Black communities, inclusive of the LGBTQI communities, but inclusive of traditional institutions as well. We need to reinvigorate our energy to remind people, although we have had success with HIV and AIDS, the pandemic is not over. Now is not the time to lift our foot off the gas. Quite frankly, now is the time to push our foot onto the gas in a wholehearted, holistic manner.
And so what should people do to stay safe?
Well, number one, there are obviously advances we've made in treatment and prevention. Today, if you're diagnosed with HIV, science will allow you to live, quite frankly, a normal lifespan. Today, if you're diagnosed with HIV, there are treatments that actually can stop the progress of the disease in your body. On the prevention side, we have tools like U equals U, which means that if you're undetectable, you cannot transmit the virus. So both the treatment is a prevention tool so that we don't transmit the virus to others. We also have PrEP, pre-exposure prophylaxis, which allows people to protect themselves from acquisition of the disease. We also need to face the issues around community activity and access to the disease, because although these treatments are available, the uptake is not the same in Black and brown and other people of color communities and in poor communities as they are in wealthy communities and white communities.
Now, I don't know why anyone would go on the internet and lie about saying they have HIV, and I believe she may have it. But at first she hesitated and couldn't even remember the false number. She then said that she wishes she would visit Atlanta, something that a negative person would say. Then towards the end, she states that she is positive, and as per the caption on her video, she contracted it in Atlanta. And mind you, when I commented under her video and asked her sources that could direct me to this 20,000 number, she deleted my comment. And when you go to the comment section of any of these people's videos, whenever someone asks for a source, they all say the same thing: do your own research. And they never provide any sources because they can't.
John Ferreira, Phil Harrington.
At sunrise this morning, they began their tribute to people who died of AIDS. The task of reading out their names, often more than their friends could cope with.
Jose Sal's.
From all over the country, the families and friends of the victims had gathered to watch the unveiling of a huge quilt the size of a football field. Each panel bore the name of an AIDS victim. Often groups had made the panels, trying to catch something of the spirit of their lost friends in the design. When it was done and laid out in front of the Capitol building, the quilt was, as it were, lying at the feet of the American Congress. The government here is much criticized by the gay community for not doing enough to educate people about AIDS. Congressman Jerry Studs was among those taking part.
This administration absolutely refuses to engage in serious, widespread national public education. That, in my judgment, using words very deliberately, very calmly, is criminally negligent.
There were 2,600 names in all, each one a story of personal tragedy. Mike Trummer spread his dead lover's ashes on the panel bearing his name. Elsie Cohen lost her son to AIDS just a month ago.
He was just a wonderful son.
This afternoon, AIDS sufferers led a march past the White House, organizers estimating that 100,000 people took part.